Okay, well, thank everyone for your patience. I know it's just a few minutes after the hour, but I do appreciate your patience as we just waited for a few people to get joined on. But I do want to welcome everyone to the latest VIA Live product training webinar series. And today we're featuring the MiraCradle Neonate Cooler. What we'd like to do first, before we get into the actual presentation, is just introduce everyone to the webinar series and explain a bit about how that works. So for those of you that are new to VIA Global Health, what we are is a medical equipment platform for emerging market medical distributors that makes it faster, easier, and more affordable for you to source, quote, purchase, and ship products from around the world. So currently we have thousands of medical products, all available at our online platform with all the information, pricing, and detail that you need to make your inquiries and tenders happen. So just a quick information about VIA Global Health, if you want to learn about more about the company, is you can go to this company and go to the About VIA. And what that will do is bring you to a page where it has all of the information you could possibly need to know about our company, our overview, what we do, different publications and partners that we work with. There's introductory videos, there's information about our offices as well. If you go to our other About sections, and you can learn about the team to see who's located in your market or just about how our company started. You can also learn a little bit about things like our market insights department or our rewards program, where every time you're involved in our market insights program or you are making a purchase with us, you earn points that can be used towards free products and services. So taking it back just quickly to our homepage, what we're trying to do is make it as fast, easy, and affordable for you to find the products you want, to get the quotation and make a purchase. So what we do is we feature a few products that are some of our innovative products or something new to the market. We see some of our testimonials from customers there. But there's also a few other ways to search for products. So product categories is one of our most effective and used ways to find the product you're looking for. So if you're looking for something in audiology, if you click on that, that would bring up all of our audiology products. The same would go for lab equipment. For this example, I'd like to just go to the maternal and newborn health because that's a bit relevant to what we're going to go through today. So this would show you all of the products we have listed for maternal and newborn health, the MiraCradle Neonate Cooler being one here. So that's one of the ways that we make it as easy as possible for you to find the exact product you're looking for. So if you know you're working with a lab technician, you can go directly to our lab category and see all of our laboratory products there. Another way that's really the most popular way that most people use our search features for products is to just use the search bar, similar to what you would use with something like Google. It would just be typing in, oh, if I can spell it correctly, that would be better. Sorry, it's a little bit early here. So if you type in the MiraCradle there, what it'll do is pop up a suggestion. If you're writing in something that's not exact matches, maybe it's a misspelling, or maybe you're asking for something we don't have, what you can then do instead of clicking on that exact match is just click on that magnifying glass there, which brings up any products we have. In this exact example, we only have one product that matches that search criteria. So it brings you exactly to the MiraCradle Neonate Cooler. So what we'd like to do here, just on our product page, essentially what this is every time is a brochure for this product. And you can actually download this brochure once you're on the product page. And by doing that, you can just go right here, click on either of these two icons where you're going to either save the PDF or print it. So what I would suggest is clicking on that just PDF so you can save it. And what that does is it allows you to download the brochure, which is the product page. And so what that would be just showing up like this. You see all of your pictures, all of your product information, all additional detail, everything is there. So you can now download that or print it and take it offline with you as you go to your meetings. But the important thing here is we want to give you all of the information you possibly need in order to submit for your inquiries and your tenders. So we know that people ask all the time for pictures of the product, both as a visual of kind of a graphic, what it could look like, but then also seeing the actual product used in environment. There's also some additional kind of information pieces here, so you can look and see, and really any additional content that would be visual. So we want to list that there. We list you a short description here as well, regulatory approvals, because of course we know that's very important for most of your customers, especially for government orders. And then you can see additional details for a description of what the product does, what makes it different, how does it stand out. A little bit of information here about product testimonials, so hearing from others who are using the product, which we know is important. Any frequently asked questions, which is also important. And then there's a video section. What we'll also do with this webinar once we're finished today is we will upload this content to the page. So you'll also be able to watch this again. You can share this with any customers that are curious about the product or use it in your sales presentations as well. Some additional product documents here, things like your brochures, which we know are very important for any tenders or inquiries that you submit. It's required that you have your brochures with it, any warranty information as well. So there's some basic details there. So again, everything we're doing here is to make it as fast, easy, and affordable for you to find the information that you need so that you don't have to call or email and wait long extended periods of time for answers, which is a bit how the traditional model is for sourcing equipment. So we're trying to make things more efficient and easy for you, the customer. So with that, I'd like to actually hand it over for a presentation from Udit Mangal, who is the product specialist working with the MiraCradle.
Good morning, everybody. It's pretty early to join for a webinar at 7:12 in the morning. So let me introduce you to MiraCradle Neonate Cooler. It is an affordable and a validated device to treat birth asphyxia. Before we talk of the device, let's have a sneak peek into the cause of global children deaths. So according to WHO, birth asphyxia causes close to 11% of deaths among children below 5 years. But when it comes to neonates, this becomes the second highest cause of death amongst neonates after prematurity. In 2014 alone, over 650,000 neonates died because of asphyxia across the world. What is the cure then? As you can see in the present scenario, therapeutic hypothermia, meaning cooling the newborn baby body temperature to 33.5 degrees Celsius and then maintaining it between 33 to 34 degrees Celsius for 72 hours, has been the only proven medical intervention which can be rendered as effective in cases of birth asphyxia. It is known to reduce the risk of death or major disability and increases the rate of normal survival. Although therapeutic hypothermia has proven to be the only medical intervention, the standard cooling equipments available in the market are very, very expensive, costing approximately $15,000 to $20,000 US dollars, and cannot be afforded by most hospitals, particularly when it comes to low resource setting areas. Doctors therefore tried several low-cost methods, most popular being the use of ice packs to cool down the baby. However, use of ice packs was not validated. Due to the very low surface temperature at around 0 degrees Celsius, ice packs can cause a thermal shock to baby. It can induce a lot of shivering and can also increase the risk of subcutaneous fat necrosis. Moreover, ice packs have to be changed quite frequently, leading to a very high level of manual supervision. So the problem was that the medical fraternity, while it knew what the treatment is to be given, it wasn't affordable. And therefore, that is where MiraCradle came as a rescue. Developed in collaboration with an Indian missionary hospital, CMC Vellore, MiraCradle is an affordable passive cooling device which uses the advanced phase change material technology to induce therapeutic hypothermia among newborns suffering from birth asphyxia. The device is extremely easy to use, it is safe, it is lightweight, portable, and above all, it gives precise temperature control of 33 to 34 degrees Celsius for about 72 hours with minimal manual supervision required. The device does not require any electric supply and is extremely safe to be applied and used with babies. Now, before we get into details of the device, let us also have a look at what PCMs are. PCMs are phase change materials, which are special thermal energy storage materials that can store and release heat at a particular temperature. The thermal energy transfer occurs when the material changes phase from solid to liquid or liquid to solid. So as you can see that PCMs store a lot of energy and they release it whenever required. In a way, they act like a battery. So why PCMs? PCMs behave differently than water. In the most simple way, PCMs are much more precise and efficient than ice or water. While ice has its melting temperature at about 0 degrees Celsius, in MiraCradle we use the patented form stable PCM that has melting temperature of 29 degrees Celsius and therefore maintains the body temperature precisely between 33 to 34 degrees Celsius. Also, since the gradient between temperature to be achieved versus the melting temperature of PCM is less, the PCMs used offer much higher backup hours than ice, typically throughout the course of therapy. PCMs can therefore be used repeatedly just like the batteries and are much safe to be used as against water or any electrical device. This is how typically the device looks like. It is awarded for its ergonomic design and ease of use. Typically, the device has four components. You can see the one in blue as insulated cradle. It is a roto-molded plastic structure which serves as a framework for placing all the other components of device and also provides insulation to the PCM, helping it last for much longer hours. Then the next layer, as you see, is that of SAVE FS29 PCM. This layer forms the bottom part of the device. There are three bricks of FS29 PCM which are placed at the bottom of the insulated cradle. FS29 in solid state extracts heat from the neonate's body, which is at 37 degrees Celsius, thereby inducing therapeutic hypothermia and sustaining it. The next layer, as you see, is that of FS21. This is the second layer and is used in conjunction with FS29 to quickly bring down the temperature of the neonate. This layer, particularly FS21, can be removed subsequently, and the maintenance of temperature is taken care by first layer FS29 alone. The top layer, as you see, is the conduction matrix. It is a gel bed which provides a smooth surface for the baby to lie on and improves heat transfer between the baby and the PCM. And on top of it lies the baby. So coming on to the features and benefits of the device is CE certified and offers whole body cooling as against any localized part cooling. The device is extremely efficient and precise, can maintain temperature for the entire duration of 72 hours without needing to be changed. The device is affordable, almost at 1/5 the cost of the other devices available in the market. It's extremely easy to use with no supervision required. PCMs can be charged in the lower part of the refrigerator. Next. The PCMs are designed for reuse and therefore the device is almost maintenance free and it is extremely safe, no electrical requirement. Now let's have a look at the clinical data that is available to us. So far, 2 clinical studies have been published in India to show that the temperature stays stable for 72 hours. The first trial was conducted on 41 babies. The mean standard deviation temperature during the cooling phase was 33.5 degrees Celsius with 0.39 degrees Celsius deviation. Throughout the cooling phase, the target temperature range was maintained in 96.2% of the time. There was no temperature reading at less than 32 degrees Celsius. The second trial was conducted on 103 babies and at 10 different hospitals. The mean of time taken to reach target temperature was 90 minutes. And the mean standard deviation of temperature during cooling phase was 33.5 degrees Celsius with deviation around 0.39 degrees Celsius. Temperature readings were outside the target range in 10.8%. So, so as you can see in the graph, the temperature remains stable throughout the duration of therapy for as long as 72 hours. And it does not require any change of PCM in between. While this is not an exhaustive list of our user base, typically only from India, but the device is now being increasingly used in several countries of Africa, including South Africa, Kenya, Malawi, Botswana, Laos, and in other Southeast Asian countries as well. These are the testimonies by a couple of our earlier customers, by Dr. Vishnu Bhatt from Jipmer Pondicherry and Dr. Sanjay Wazir from a private hospital, Cloud9 Hospital in Gurgaon, India. They look at this device as an extremely effective device and affordable, of course, but requires some bit of manual supervision as against the other automated devices. So just to conclude, MiraCradle is a medical innovation to deliver efficient therapy, which it does by being precise and validated, has been designed ergonomically for use in low resource settings, and it is extremely affordable. Not only is the device affordable for one-time purchase, it is virtually maintenance-free and runs on reusable PCM technology. We have also won several awards for the device. Some of them includes the WHO funding that we got. We were also funded by Lockheed Martin, USAID, MIT, and several Indian bodies. Just the snapshot of our awards and recognition.
So one of the first questions, I know you mentioned that there's no power required. So at no point does this require to be plugged in or have a battery. It's always separate from any power requirement.
Okay, so the device per se is power free. It does not require any electricity during the course of the therapy. However, the use of device is not alone. While the MiraCradle is being used, it needs to be coupled with few more ICU level devices that may require power to run.
Okay, and that makes sense. Another one, I know you mentioned it's essentially maintenance free. There's kind of two questions that have come up about that. One is there any kind of sterilization that can be done? Obviously, I would assume this can't be autoclaved, but should it just be wiped down with an alcohol solution? How should this be sterilized between patients?
So the sterilization process has been outlined in the manual, the product manual. However, it doesn't really require any special sterilization treatment. You don't really need to autoclave it. Just the use of 70% isopropanol alcohol is good enough for the device.
Okay, perfect. And then as far as, I guess, disposables, consumables, are there any that would be associated with the product, or is it completely free and clear of any need for consumables?
There is virtually no need of any consumables to maintain the device thereafter. However, these PCMs have a tested shelf life of 3 years. It is recommended that after 3 years, the PCMs should be replaced, which are available as spares. Yes, and also in some cases where the damage is found in the PCM. Otherwise, for regular running of the device, there are no consumables to be used.
Okay. And I know you mentioned that after 2 years, some of the levels need to be changed. Is that the same for the conduction mattress, or is that should be something that should be changed more often?
So as you saw in the design picture of the device, there are typically 4 components. One is the cradle, and then there are 2 layers of PCMs, and the third one was conduction matrix. Conduction matrix and 2 layers of PCM require changing after a certain period of time. Those are not yet to be called as consumables, but we specify the shelf life of those products for about 2 years.
Okay, perfect. And then I guess there's a few questions just about the actual use of the product. A few were based on, I guess, if there's any recommended length for how long a neonate should be exposed to the device, or is it something that can be used for? I guess the question would just be: is there a recommendation for a period of time that a neonate should be placed on the MiraCradle, or is it on a case-by-case basis?
Uh, to be honest, there's no recommendation from our side. However, doctors and several publications have recommended that the therapy should be given for a minimum of 72 hours.
Minimum. Okay, that's perfect. So a few people have just asked, I guess they're a little bit new to the concept of birth asphyxia. Can you just talk a little bit about the symptoms of birth asphyxia and how they can better sell this product to some of their doctors with a better understanding of the use case?
So while I'm not a clinician to be able to precisely answer that, typically birth asphyxia is a medical condition in which there is a deficiency of oxygen in the baby's body, and that results in slow neurological development. Prolonged asphyxia can also lead to severe encephalopathy. Now, that encephalopathy as a term means that the brain swells up. The only way to take care of birth asphyxia or perinatal encephalopathy is to induce therapeutic hypothermia, meaning that the temperature of the baby needs to be brought down from 37 degrees Celsius to 33 to 34 degrees Celsius, and that temperature needs to be maintained for, as I mentioned, 72 hours. Uh, Typically, clinicians need to diagnose a baby for moderate or severe encephalopathy. They also need to diagnose the patient whether it can be called uh, as an asphyxiated child or not, and then go about giving therapeutic hypothermia. For that diagnosis, there are tools available in terms of APGAR scores, SARNAT metrics, which are better known by the clinicians than I would be able to comment upon.
I know we list the different regulatory approvals there. A few people have asked if there is any plans for FDA approval.
Not immediately. For now, I think we'll have to settle with CE. So,
Okay, that's perfectly
yeah.
fine. And then just a bit of a question about where is the product manufactured and where does it ship from?
The product is manufactured in India and is also shipped from India.
Okay, perfect. And then kind of just logistical, the warranty information. And I think you had mentioned the warranty, but if you could just touch briefly on the warranty and how it relates to each of the different layers of the MiraCradle.
Okay. So each part has a different warranty to it. There are 4 layers in the MiraCradle as we observed, and the warranty instructions will be laid out with the warranty card that goes out with the system. Typically, the entire device is covered for about 1 year of warranty. Some parts are for with 2 years of warranty, some are less. Yes. However, warranty does not cover any physical damage to any of those layers. Yeah. So each layer has a different warranty.
So I really only see one other main question that's come up. So I think we may actually, unless other people have last minute questions, I'll touch on this last one. And then we can just kind of talk about anything that may have been missed. The question that's come up from a few people, and I think it's mostly because they have varying different environmental factors with humidity and temperature in their facilities. Does the MiraCradle have any, I wouldn't say limitations, but does it function differently in different environmental factors, whether it's the heat in the clinical environment, the humidity levels, anything like that, or is it always going to function the same, whether it's 20 degrees Celsius or 40 degrees Celsius in the environment?
I'm glad you brought that up, Brian. It's a genuine question to have. The device comes with the clear instruction to be able to be used only at NICU level 3 facilities. neonatal ICU level 3 facilities. And whatever testings that have been done, it is based on an air-conditioned control room temperature environment of around 26 degrees Celsius. So we assume that a NICU level 3 facility will be air-conditioned and will maintain the temperature around 26 degrees Celsius. 1 or 2 degrees Celsius here and there would not matter and would not impact the performance of the device at all. However, it is not meant to be used at a place where there's no air condition and the outside temperature is as high as 40 degrees Celsius. So.
Okay, perfect. No, I think I'm glad that question was asked. Doesn't look like there's any more questions. Udit, is there anything further that you feel that you'd like to touch upon before we finish?
We have also compiled a list of FAQs and we keep updating that. I think for now, the shared information is good enough, but we can also share the FAQs for someone who's more interested and can go through these FAQs for enhanced understanding.
And I think that's a good transition point to, for any of those folks on the line that have been asking about quotations, samples, pricings, things like that, which we don't want to focus on for the webinar. You can obviously contact us how you typically would. So you can reach out to us through our email, through our WhatsApp line, or you can contact your country representative if you're one of our verified distributors. You can obviously visit the product page for the MiraCradle. Everything here that we've talked about, from regulatory approvals to brochures to product manuals and videos and testimonials, it's all listed here. So if there's anything that you need, this is your first resource. If not, you can definitely reach out to us directly by using those modes of communication that I had up there just a moment. But with that, it looks like all of our questions are in. Udit, I'd like to thank you for your time and your thorough presentation and for taking our questions.
Thank you. Thanks for hosting this, Brian.
Of course. And for everyone on the line, thank you for joining. And we look forward to you on the next VIA Live product training webinar. Thank you very much.